and they've, done the ultrasounds, and they might already know the cord is around his neck. But if the vitals are good and the baby's heart rate is really good in their meetings with the OB doctor, it's probably okay. But you guys, it's common. It's really common, and it's really easy to get that cord off their head. So we'll talk about that as well. Okay, so those are drugs, medications, allergies. A lot of women are on prenatal vitamins. They're on some kind of enhancement drugs. I can't think of the name of it, but they give the baby, give the mom the vitamin or whatever for the baby's brain health. You want to know her allergies as well. Gravida para, this is the G. This means how many pregnancies has she had, including this one, and how many live births she's had. So if she's gravida 4, para 3, what does that mean?
1 stillbirth.
Yep, 4 pregnancies, 3 live kids. This one, when it's born alive, will be the para 4. So she's not para 4 yet, right? Because she's still pregnant, pushing it out. Once the baby's born, now she's gravida 4, para 4. Now think about this. Can you be gravida 4, para 6?
No.
Yeah.
Oh, yeah.
Twins or triplets, right?
Lock them up.
So, why would you want to know if she's had triplets or twins before?
Because she could be having complications.
Yeah, she could be having this time. Well, is this a twin? Are you having twins this time? Because I need to call for more help. You're going to ask her, right? What if she's gravida 3, para 0?
That's not good.
She's stillbirth.
Yep, she's either had a stillborn, couple abortions, miscarriages along the way. We don't really need to get into depth of that, but if she's like gravida 10, para 1, we're scared, right? Because something happened in all of her pregnancies that we needed to be aware of. This one could be born a stillborn or something like that, right? Okay, but it probably won't. Expected due date, that kind of goes on up there with the prenatal care. Hopefully if she's seeing the doctor, she knows her due date, and then you're going to do the math in your head too, because if I say I'm due July 8th, and today's what? Am I good? Yeah, I'm a little early, but I'm way good, right? What if my due date is August 1st?
Yeah.
Not good.
And I'm having contractions?
Pull her out.
We want to get her to the hospital to stop her contractions so that baby can cook a couple more weeks, right? All right, so yeah, we want to get her to a better point so her baby's good. See why I don't want you to put it on YouTube? Don't you dare put me on Facebook.
What's the
We just have a
limit?
Facebook page.
What's the limit of what?
Like,
The due date?
yeah.
34 weeks, remember?
34 weeks?
So 40 weeks is the normal gestation period of a human being.
So if it's under 34 weeks?
We're worried.
Yeah.
We need to get her to the hospital so they can stop her labor.
There's a,
Paramedics in some areas can give a medication to help stop the labor. I don't think Riverside County has it, but you could ask a paramedic or Mr. Dr. Nolet.
At 34 weeks, if she can't hold it, you can still give birth to the baby,
Yes.
right?
Well, yeah.
Yes, yes, yes. If it's coming out, you're going to deliver it whether or not
With
it's...
him being good or not.
Huh? Yeah. But be ready to support the baby. Respirations, keep it warm. You may have to ventilate with a little TDBVM or do blow-by oxygen to that baby. You might have to really work on that baby to keep it crying and alive.
If the baby's due August 1st, that's only about 4 weeks away. So
Yeah, so
it'd
we're
be
good,
risky, but it's still
right?
okay.
36 weeks she should be. How about like September?
No.
So you really want to know that due date. That's just my point to that. Yes, ma'am.
What about if they tell you they're like a month and a half to 2 months late?
Late, then the baby's going to be big, and you might not be able to get a vaginal delivery.
I had a brother who was over a month and a half late. My oldest brother was over a month and a half.
And how much did he weigh?
I don't remember how much he weighed. I know he does have scarring in his lungs from inhaling his own feces in the womb.
Oh, yeah. We talked about that too. That's the meconium birth. The baby can, in utero, do his first bowel movement, and it's kind of greenish, brown, nasty stuff. So remember when I said the fluid's going to come out? You're gonna look at it too as the baby's coming out
Is it
to
supposed
see
to
if
be
it's
black?
tinged.
Huh?
No,
His first one is supposed to be bleeding.
no, his first poop is black.
There we
But
go.
if it's
Yeah.
if he pooped on
Inside?
during the delivery, you don't want him to inhale that because he'll have aspiration pneumonia and maybe die if he breathes in or drinks that amniotic fluid and sucks it into his lungs. So you know they're always being that's the way they breathe with the amniotic fluid. It's just going in their mouths, expanding their lungs. It gets peed out all this time while it's in the uterus, which is a closed environment, a closed capsule. And not often does the baby poop while he's in there. It's usually the stress of delivery that causes them to have their first bowel movement in the birth canal and then the complications from that. Okay? But big babies, think of that. If she's past 40 weeks, I don't know why they would let her go that long, but maybe she has a scheduled C-section for Monday and now she's in labor on Saturday. That happens more than not.
So what would you do if the
You're gonna try to deliver it.
But like if you delivered them and they have like stuff
Meconium,
in their,
you're gonna clean off their airway. You're gonna use your bulb syringe, that thing right there. You're gonna suction that airway constantly and make sure you get all the black, gooey, greeny stuff out.
Scissors are right there.
Yeah, thank you. There's my cutting tool. Okay, so bag of waters is, did it break? Did it have an odor or color? And when and where did it break? Because if it's in the home, you want to go look at it, right? You want to just kind of give your idea that it doesn't have meconium in it. If it's not bloody, you want to know those things. You want it to be a clear, odorless water, amniotic fluid. You want that. If it has any discoloration to it or blood, you're going to worry that this mom may hemorrhage. Maybe something happened that she tore, or the placenta tore away from the wall of the uterus, and that caused bright red blood. Okay, so we're worried when we see bright red blood on a birth. Okay, so the next three things that we're going to ask her after all these questions, you guys make a card with this, kind of go over it with each other so you know your pledge bow, like I didn't. And then the next thing is imminent delivery. So that's when we're going to make our decision to stay here and deliver this baby versus getting in the rig and delivering it at the hospital. It is, if her contractions are 2 to 3 minutes apart, which your partner's doing that, he's holding her stomach, it should get rock rigid hard. She's like in pain, breathing through her contraction. You're timing it, and she breathes and relaxes, and then, oh God, here comes another one. Okay, we're staying, right? If it's that close, under 2 minutes, we're staying here and having the baby. And then, is it crowning? Okay, so you're gonna look, you're gonna scoot her pants and underwear off. She might already be that way when you get there. And you see this bulge in the perineum, you guys. So you see it like a softball right between her legs. You'll see the head is right there ready to come out. You may see hair on the little Asian baby. You may see a bald head on a little white baby. And you'll see the cutest little curly cues on the little black babies. It looks like somebody took a felt pen and drew little ringlets. It's so adorable. So anyway, and you'll notice that it's not a butt, right? That it's the head. Or not an elbow or whatever. You're going to check and see that crowning is present. And you're going to ask her if she has the urge to push. Shh. Anybody here giving birth besides me? You guys should be in the magazine. You should be famous. All right, the urge to push cannot be stopped. It feels like the most overwhelming desire to push this baby out. I'm done. I've been doing this for 40 weeks. I'm going to push this baby out no matter what. It kind of feels like a great big bowel movement to the mom. Like the best one you ever had. Like you've evacuated. All right? But that urge is so overpowering that if you don't want her to push yet, you're going to have to look at her eye to eye and go, come on, stop pushing. No, don't push. No puhe. No, stop. Because they will push as hard as they can to get the baby out. We want in the field to deliver the head, do some stuff, get her to stop pushing, and then on her next contraction, push the shoulders and the rest of the body out. That's the ultimate goal. If the baby comes all out in one push, at least you've got your hand there to hold it to prevent expulsion or the baby shooting out against the back wall of the ambulance or whatever, because she will have that power. It is that powerful. Okay. Mr. Duncan, the doctor, and the nurse went to catch Kelsey when I pushed her out. She came out like a little rocket. And they all went to grab her so she wouldn't fall in the trash at the bottom of the delivery table. Yeah, so I was glad all 6 hands were there to grab her because I did push that hard. And that was my 5th child. So imagine that. All right. Keep it in your imagination. All right. So we've decided to have this baby now, right? We've decided. Yes, sir?
Well, I just had a quick question. I was going to say, when it comes to giving birth, is that something that we can do, or would we have to call a paramedic?
Oh, no. This is an EMT skill. Above and beyond. No. The paramedic is not going to do this. You guys are.
Oh, we are?
You're going to get in all the muck and guck. He's going to start an IV. He might put the heart monitor on her, get her on oxygen, or start writing paperwork. He is not going to do this, I guarantee you, unless he's a go-getter and he really wants to do it. But most of the time it's the EMT doing this, and then he's doing the assessment and taking care of the baby, worrying about suctioning and oxygen and that kind of
So
thing.
he does all the vital cycle and just sit there and actually give me
Yeah. And you're cleaning up as well. You get to clean up. And he gets paid more than you do. All right. Let's do this fast. Okay, so now I've decided to stay here because I'm having the baby. It's 2 minutes apart. She wants to push. She's crowning. We've checked all of it out. And we put this Chuck's pad thing underneath her fanny, right? She's not sick. Ask her to lift her hips up and stick it under there so it catches all the goo. Oh,
Yeah, get in there.
I gotta put this back.
There you go.
All right. So then I go through my OB kit because I want to make sure I had a sterile one. Remember, I want to make sure I have a sealed bag or box that it came in. And I'm going to start opening up everything. Even my partner should start opening up everything because it's really hard when the baby's coming out to start emptying all this stuff out and gathering it up. And everything is double wrapped. I love it. So you've got your sterile bag that is right here, and then you've got alcohol wipes, you've got OB wipes to clean her perineum so the baby's head, this is so old. All right. You've got cord clamps. See how they're sealed up? You just want to open all these packs and have them laying here ready. Okay, so you're going to open them. This one came with 2 in 1. That's really good. So you only have one thing to open. These gloves are too big for me. Okay, so yeah, you're just going to drop everything right here, kind of in your work area. You've got a pad, an OB pad for after when she's bleeding. So you want to open it and have it ready. Open your pack and have the OB pad ready. You want your bulb syringe. See how it's sealed up? Everything. Open it, open it, open it. So we'll use this one that's opened already. These are the 3 towels they give you to clean the baby with. Aren't they generous? So you might have extra towels. You can use the 4x4s. They're sterile as well. You're going to open them up, have them ready to clean the baby off. You've got these sterile gloves. And I'm not going to show you today how to put them on because it takes a few practices to do it. But you want to open them up and